to action.
I am a few months shy of that actual degree, but I'm not going to let that keep me from being on the front lines.
In a stunning move, medical students and retired doctors and nurses being recruited to help at overwhelmed hospitals from coast to coast. Today, Thursday, March 26th, 2020.
From NBC News, this is a special edition of Today, the Coronavirus Pandemic.
This morning on In Depth Today, the huge need for more healthcare workers in the battle against the coronavirus. Overnight, the U.S. Army put out a call to retired military doctors and nurses asking if they would be willing to come back and help. This as other retirees and even students all across the country are answering the call. NBC senior national correspondent Kate Snow is taking a closer look at that. Kate, good morning.
Savannah, good morning. From Virginia to Washington state, governors are now calling for more medical help. Here in New York, certified medical professionals who haven't been in hospitals or clinical work for years are now suiting up, heeding the call despite great personal risk.
This morning, young students and older retirees joining a common cause to fight COVID-19.
Anything else you need before?
Alyssa Ryan was ready to receive her nursing degree from the College of New Jersey in May. Now she's triaging phone calls at a county health department, many from parents worried about their kids.
I've had 4 years of nursing school, and unfortunately, I am a few months shy of that actual degree, but I'm not going to let that keep me from being on the front lines as much as possible.
In New York, NYU is allowing med students to graduate early so they can potentially help in strained hospitals. Governor Cuomo Wednesday saying the state is putting together a surge healthcare force.
Go back to nurses and doctors who may not be in the hospital, direct medical care occupation, and ask them to sign up for possible reserve duty. God bless them, 40,000 people have signed up.
Michelle Petticone left clinical work to teach a few years ago, but she still has her license as a respiratory therapist. So Wednesday, she filled out paperwork to be on call for 2 Syracuse hospitals.
I anticipate they will need me as much as I can give them. I think we're just seeing the tip of it, and it's going to continue.
Are you nervous about getting sick?
I think we should all be a little nervous when we go out there. So yeah, absolutely. And I think having that little bit of nervousness, maybe a little bit of anxiety, will help me to be even more careful.
For more than a week now, hundreds of medical students from the University of Minnesota have been helping by babysitting and running errands for other first responders, earning presidential praise last night.
These inspiring Americans remind us that we all have a role to play in winning this great national battle.
Judy Salerno, who has decades of health policy experience, is ready to go back to internal medicine and geriatric care and says everyone needs to think right now about what skill they have and use it.
We all have to do what we do best. That's the only way we're going to get out of this crisis. We can all be heroes in this situation. We're all doing our part, and that's the way we pull together, and that's the way we're going to come through this.
New York State has asked for more than 1 million additional healthcare volunteers. One of the things states are doing, Savannah, is trying to prepare in case the first line defense, the doctors and nurses that are working right now, get sick. And both Judy and Michelle told me they are ready and waiting for the call. Savannah.
Our heroes, Kate. Thank you very much.